February 4th marks World Cancer Day, and according to Statistics Canada, here is the reality. 2 in 5 Canadians will be diagnosed with cancer during their lifetime. Another stat, approximately 1 in 4 of them will be dying from the disease. So here to discuss more, there's a lot to discuss. Something about how early detection can actually help, but also some of the barriers. How can we make a difference here? Dr. Roochi Arora, oncologist with Humber River Hospital, joining me now. Thank you so much for being here.
Great to be here.
The numbers, sadly, are not surprising. You've seen this day in, day out. Let's start with why they are so high. And barriers really seem to be a key here. It could be where someone lives. It could be their race. It could be their gender. There are so many. Let's begin with what you are seeing when it comes to barriers, when it comes to cancer prevention and treatment.
Yeah, there are many barriers, as you said. You know, if we think about the typical journey of somebody who has to get screened, so this means that you need to make an appointment with your primary care doctor. You need to have a primary care doctor. You need to be able to go to a screening facility that has screening in place. So that means you need to be able to probably take a day off of work if you're working. Make sure your kids are looked after so that you can actually go over there, get whatever testing done that has to take place. And then if you get called for a follow-up, you need to go back and do the whole thing all over again. So there's quite a bit involved in this whole process. And then add on top of that, you know, the guidelines only put these things in place for certain ages of people. Quite a few barriers to this access.
As you're naming all of these different hurdles, I want to say, for some people, because not everyone can take the day off of work. Well, that means one less day of pay, one less day of putting food on the table, these sorts of things. Let's talk a little bit about guidelines, which you touched on. Recently in Ontario, the self-referral for mammograms, that went down to 40, and that is great. I can put my hand up and say as soon as I saw that, I went and I booked one immediately. But do you think it should be lowered for other kinds of cancer? You also talked the lower end, but also the higher end when it comes to the age brackets. So where do you see things? Where should they be?
That's a great question. I think it's a bit of a tough thing to discuss, and I think in a lot of ways we have to follow the evidence. Right now, at least in terms of breast cancer for mammograms, we have evidence that starting around age 40 for the general population, so this means an average risk individual, that is where we are starting to see benefit. Below 40 can be a little bit difficult just because there are nuances around the techniques with mammograms and denser breasts and things like that. We talked a little bit about the upper end as well, though. So as I was saying, I have many patients who are living really well into their late 70s and into their 80s, and yet the guidelines say stop at age 74. And then unfortunately, many patients come in their late 70s and early 80s with probably larger breast cancers than they needed to be, because if they were still screening, they probably could have been detected a little bit earlier. I think as people are living older and living better, maybe the guidelines need to catch up with that upper end.
How do you think that we are doing as a province, as a country, just when it comes to education? I know there are a number of barriers that we talked about, but just being aware of our own bodies and advocating for ourselves.
Education can always be better. Education starts in our schools, it starts in our doctor's offices, and I think with doctors being so busy, you know, a typical primary care doctor has so many things to address from head to toe. Unfortunately, a lot of the visit is focused on just putting out fires that are right in front of them. It's really hard to then take that next step and focus on prevention and education.
What would you say to someone who, as you said, not everyone has a family doctor here in the province? If someone doesn't have a primary care physician and they sense something, you know, they want something checked or they sense something is wrong, what is their best path forward? So even if you don't have a primary care physician, you should still be able to access a physician, whether that's through a walk-in clinic or urgent care. You know, ideally, we're keeping these people out of the emergency rooms if it's not a true acute emergency. There should still be somebody you can access, and from that point on, they can order the appropriate tests. And if you need to end up in an oncologist's office, that should happen fairly quickly. What would be your last message for any of our viewers here? Because, you know, there's a lot of information also out here. As I'm looking, you know, at my laptop, it's easy for people to go down the rabbit hole, write down symptoms, and all of a sudden it comes up this or that. What would be your overarching message to our viewers when it comes to cancer prevention or detection?
My overall message is it's important to be empowered, take your health into your own hands, and I really want to stress that screening does save lives. Most people don't know this, but cancer is in large part curable if it's caught early enough.
Dr. Roochi Arora, appreciate your time today. Thank you so much.
Thank you.